Hello, I am Dr. Deepak Garg, and our today's topic for the Journal Club is outcome of total ankle replacement versus ankle arthrodesis for the treatment of end-stage ankle arthritis. So in the OPD, when we have many patients with the end-stage ankle osteoarthritis. So usually in those patients, we have only two options. Either we can go for the ankle arthrodesis, where we fuse the joint, or we can go for ankle replacement surgery. So if we want to compare both the treatment options, so we have this article. I will put the link of this article in the description, and this is a recent article published in the JBJS, and this is evaluating a 10-year follow-up of operated ankle arthrodesis versus total ankle replacement surgeries. So they included the patients with a skeletal maturity who had 10-year follow-up, and they who give the informed consent, and they excluded the patients with the AVN of the talus, or those who had infection, those who had Charcot's arthropathy, or those who are obese with a BMI of more than 35 kg per meter square. So let's compare the results of patients with ankle arthrodesis with the ankle arthroplasty. So if we want to look at the reoperation rate. So which category of the patients will need further surgery, second surgery in future? So they found that the patient who underwent ankle arthroplasty, they needed resurgery significantly higher as compared to the strata with the ankle arthrodesis. So if we want to give a one-time solution to the patient's ankle arthrodesis, is definitely a better option as compared to the ankle arthroplasty. So if you want to look at the infection rate, again infection rate is significantly higher in patients with the ankle arthroplasty. Now if you want to look at the functional outcome and the disability score, then the functional outcome and disability score is better in patients with the ankle arthroplasty. So if you want to have a good function, then definitely, because there is an ankle range of motion, ankle arthroplasty is a better option. So this is a very difficult decision between ankle arthrodesis and the ankle arthroplasty. So we should always individualize our treatment. For example, if we have a young patient who is more demanding, who wants to play sports, and definitely we want to give a more stable construct, and we want to give a more, patient should have a better function. So in those scenarios, we definitely go for an ankle arthrodesis. So in younger generations, we better go for ankle arthrodesis. If the patient is having a background of infection, then definitely we should go for an ankle arthrodesis. Now if the muscle strength around the joint is compromised, or the patient is having some neuromuscular disorder, then definitely again we should go for ankle arthrodesis. Now if the patient is from the elderly age group and they want a better function, and they are not very much demanding, they are not going to run, they are not going to go multiple times upstairs, downstairs, they are not going to jump, then those scenarios we want to give a better lifestyle with a better functional outcome. So in those, and they should have a better muscle strength. So in those scenario, we better choose a ankle arthroplasty. So ankle arthroplasty should be reserved for a elderly population and with good functional muscle strength, and they are ready to accept the sedentary lifestyle. As compared to the younger population where they are more demanding, more sports activity, we should prefer ankle arthrodesis. So to summarize, ankle arthrodesis reoperation rate less, functional outcome is better in ankle arthroplasty, infection rate is lower in ankle arthrodesis. For younger population, ankle arthrodesis is better. For older population with all other factors good, means there is no other joint arthropathy and just single joint involvement and good muscle strength, ankle replacement is a good. So I'll put the description of the articles in the description. Thank you guys, thank you very much.